where we have an awareness in the industry that menopause causes changes in our physical structure because of the changes in our skin integrity or whatever it is that the estrogen or the combination of hormones and the changes of the hormones can impact in different ways, it's really important to have that understanding from your side as well, how that works, what the changes might be, and work out whether actually some other treatment might be necessary for those clients.
I guess that's the advantage of going to an aesthetic doctor for treatment as opposed to a beautician who's got a diploma in fillers or something, isn't it? Because you
absolutely. We have a deeper understanding as to what underlying things might be causing the symptoms that you're presenting with. It's just the same as going to the doctor with chest pain. You know, you have to look at what the other potential issues are. You don't just say, okay, it might just be a muscle pull or something like that. You have to think, okay, what's deeper? How can I make sure that I'm doing the best for my patient? So that for me is the kind of, I tend to manage things in a little bit deeper, and I probably have one of the highest rates in our clinic of turning people away because a lot of the time I don't think it's right to proceed with a treatment. And a treatment might not be necessary at that time. It may be that I say, we need to sort out your skin before you can deal with this. We need to do X, Y, or Z before moving on to something else. In terms of aesthetics, you tend to have the illusion that this is a very superficial industry. It's about looking good, it's about making people feel better about themselves, and a lot of the things that upset me about the industry is that sometimes people can make it feel like it's a bit like nothing. It's a bit there's a lack of depth. And I always in my consultations to spend, to be honest, the majority of the treatment time just talking to people and figuring out what it is that's going on in here. Sometimes it's not about treating them. Sometimes it's about sorting out other problems that are going on in their lives, which obviously you can give them guidance for, or you can make suggestions with.
Or even just identify it. Just making them,
just identifying it and actually showing them that some of the things that are probably in the back of the head are actually validated. And there are other things that they can probably look at that they need to consider before thinking about a treatment. I mean, there's several times that I've identified that there are other medical problems going on. People have come in, for example, with problems around their eyes, dark circles, increased pigmentation, that sort of thing, or swelling, and they want under-eye treatments. And I don't, if we need to exclude other causes, we're still doctors at the end of the day. We still need to look at what the core problems are. And there may be that, we've identified people who've had problems with their thyroid and needed that treating first and foremost, because the treatments that they were coming to me for would not have solved the problem. There are so many different options out there, and we've got such a great opportunity with lots of different colleagues in the industry that we can refer to if we think that something else is going on. And this is why the kind of network with you and other professionals and ophthalmologists and dermatologists and surgeons, these are all really, really important to have this collaborative sort of way of managing patients. It's really helpful.
No, it sounds, but I mean, it sounds like you've got it absolutely nailed.
It isn't enough to just get somebody in, get them on the chair and whack filler in. it is about treating the person, and I think my patients definitely, that's what they appreciate about my treatment of them. You know, it's about what's right at the time. And sometimes it's just, you need to come in and have a chat. And sometimes people just need a chat and a hug, and you know, and a cry, and they feel better. And you know, the amount of times that that's happened, and people, you know, people come back because people feel that you're really after their best interest, which is what we all need to be. So hopefully this session, fingers crossed, will provide your patients, my patients, with a better sort of understanding as to kind of an overview of the issues that they may be experiencing,